reproductive and infertility services are ramping back up. The Chinese have an old expression. It says, "May you live in interesting times." Well, this coronavirus pandemic is certainly interesting times. I'm very happy to report that Missouri Fertility is alive and well. In early April, we had to decrease our services significantly out of an abundance of caution. We've gone down to skeleton crew 3 days a week, but we will have maintained basic services. I want to say right off the bat that if you have frozen embryos with us, frozen sperm, frozen eggs, all those cryopreserved tissues are absolutely safe. Our supply lines of liquid nitrogen are robust. The company that supplies this are regarded as essential services, and there's never been a disruption in the supply chain of the liquid nitrogen. And we don't anticipate any supply problems in the future either, so rest assured your embryos and such are safe. It is now early May. The pandemic is becoming a little more understandable, and we now understand what we need to do to be able to move forward safely. Your safety and the safety of our staff are paramount. Because of this, we are now instituting new safety procedures. For example, all patients should come in their own mask. You should have a mask for going around town anyway. Bring your own mask. My staff will all have masks on. I'll be wearing a mask, and that will minimize face-to-face transmission of virus-laden droplets. The waiting room will remain empty. You will not be sitting in the waiting room. Patients will be waiting in their cars primarily. My front office women will be texting and calling you, telling you when to come in, so there should be very little interaction with other patients or other people. We'll get you in, get you out very quickly. Now, as far as our facilities, they will be disinfected every time a patient comes in contact with them. Doorknobs, handles, everything will be disinfected frequently, and there should be very little risk of transmission of virus on surfaces. Unfortunately, we can see patients only. Husbands, partners, family members must stay out of the office. We need to minimize as many contacts as we can. I know this is kind of upsetting, but if a woman, for example, is getting an ultrasound, we have no problem her holding up her phone and taking a video of it and showing her partner and keeping them updated. Now, as far as face-to-face interactions with patients, we're doing a lot of Zoom video consults. I can see new patients, I can answer questions, we can have excellent communication with video means, and we're going to be doing this very, very frequently. And when I do have to examine someone, we will do this in a safe manner, and we will do it when we need to. But whenever face-to-face is all we need, we'll be doing a lot of Zoom video consults. It's turning out to be very convenient, in fact, and a lot less driving on your part in many instances. Now, we've had to shut down all surgeries because the majority of the surgeries I do have been deemed elective. We've been available for emergency surgeries, but the surgeries we do at Boone Hospital Center, I'm happy to say, will now be phased in. We're going to half-time the first couple weeks of May. The hospital's ramping up, and if it seems that we can get back to normal volume with staffing and protective equipment and whatnot, hopefully we'll be getting to a more full surgical schedule. Now, there are a lot of women in the queue right now. There's a backup of surgical cases. I promise we will try to move through this expeditiously and get back to a normal surgical schedule as soon as possible. Now, stay tuned on social media, Facebook and whatnot for more updates. We're obviously going to have to stay flexible and nimble in the face of changing times and changing information. But we here at Missouri Fertility are confident we can continue to supply state-of-the-art services in a safe, thoughtful manner.